Hi everyone, welcome to today's video. So today I wanted to do a little public service announcement because I think this is important, and I think a lot of pet parents need to know this because I know you guys want to do what is absolutely best for your pet, and a lot of you struggle with this particular question. A couple weeks ago, I think it was last week or the week before last. I can't remember. My weeks are kind of meshing together right now. But I had a client come in for a consult, not related to this, completely related. The pet just wasn't doing well, a sick pet consult. And as we were going through the physical exam, this consult was for coughing. As we were doing our physical exam, yes, the pet had a heart murmur. But I noticed, in addition to the heart murmur, the pet had really significant dental disease. And so as I go through my physical exam, I always show my owners what I am seeing so that they can understand and they know what they should be looking for. So I show the owner, what I'm looking at in the mouth to say, hey, just wanted to show you this. This may be part of our problem. We've got some pretty significant dental disease, and I will insert the picture here. And they were in shock. They were in shock because they had just had the pet's teeth done, new pet to me, just had the teeth done a couple months ago. And I was like, really? Okay, what do you mean? Can you please elaborate on that? Because this is really advanced. And so we start talking, and the owner had the pet's teeth done by a mobile service that came and did anesthetic-free dental cleanings on pets. This is where the public service announcement is coming in here. I did a video, and I encourage you all to watch the video on dental disease in pets and what it is and why it's important that we are not scared of anesthetic procedures when we are dealing with a medical condition that necessitates them. So this owner realized a couple months ago that there was an issue with the pet's teeth, and she wanted to do the right thing, but she was scared of anesthesia. Yes, anesthesia does come with risks. They are very minimal and are mitigated, and I encourage you to talk with your veterinarian on how those risks are mitigated. And it's costly, so it costs more to do general anesthesia, obviously, than to not do general anesthesia. So because, she thought it was a win-win, the teeth would get clean, the pet didn't have to go under anesthesia, they came to her home, and it was cheaper, that was a great solution. And this is what we are left with a couple months later. And why is that? Because dental disease in pets, and this is how I explained it to her, and this is how I want to explain it to you guys. Dental disease in pets is more than just the tartar and the buildup and the yucky stuff that you see on the enamel. Dental disease in our pets is actually above the gum line. It is in the bone, it is in the jaw. So in people, yes, we get cavities, we get that enamel damage, but in pets, we very rarely see that. We do not see cavities in our dogs and cats, okay? Very rarely. Cats get something called feline oral resorptive lesions, which are kind of like cavities, but we do not get those caries like we see in humans. Humans have a lot of enamel problems. Our problems in our dogs and cats are in the bone. It is bone disease. It is erosion and infection around the bone that then eats away at the bone, and the teeth actually start to fall out. So I know a lot of people are like, oh yeah, I had a Chihuahua and they have like 4 teeth left. I don't know what happened. They just fell out. That's bone disease. The bone became eroded away, and that socket got so wide that the tooth fell out. That's bone disease. And so it's actually much more serious than just a cavity. So it can cause systemic illness. So anytime you have a bone infection, that can cause systemic illness. So yes, it can absolutely contribute to an underlying heart condition. That bacteria enters the vasculature, can go to the heart, can cause some valvular issues. In people, it happens. In animal, it happens. So it was part of the big picture because this pet also had concurrent heart disease. But I wanted to focus on this video on the dental stuff. And so what happened was that mobile dental cleaning service came to her house. They cleaned the tartar off, and they didn't address the fact that all the disease, the actual disease, the non-cosmetic things were still present, still active, and still very much causing a problem. So this dog has, furcation exposure, meaning the bone has eroded so much, we're seeing roots, and we haven't done x-rays yet because we have to get this pet in a place where we can safely do anesthesia and take x-rays, but there's probably abscesses and all kinds of bad stuff happening underneath the bone. And her treatment of this animal has now been delayed months and months and months because it looked clean on the surface. And so, that is absolutely not the case. We need to sedate these pets and we need to get those dental x-rays so that we are not fooling ourselves in believing that our pet's mouth is healthy when we actually don't know that, and it probably is not. And so all I explained it to her was, it's like you have a house and you buy a house at auction, and you can't go in the house, you don't know what's in there, but it's probably not good. We have an idea, it's probably not good. There were all kinds of squatters and things living in the house. All you can do though is you can look in the windows and you can see it's dirty in there, and the windows are filthy. And so rather than going in the house and cleaning the house out and taking a look inside the house and dealing with the damage and destruction that is in the house before we flip it and sell it, all you did was you went around the outside of the house and you cleaned the siding and you washed the windows. Okay? It may look better from a distance, but the nasty and the things that are really gross and the things that are a real public health risk, like, the rotting refrigerator and the rats and all that stuff, are still in the house. And so that's the public service announcement I want to give you guys today. Dental disease in pets is bone disease, and we need to report some of these places that are doing this anesthesia-free dentistry because it is considered malpractice, and that you guys know, and not to get taken, because she paid several $100s to have this procedure done that was an absolute waste of her money, and even worse, made her pet sicker because it delayed the treatment that she absolutely needed, and probably has contributed now to her heart disease. And she felt horrible because she didn't know any better, and she thought she was doing a good thing. So I want you guys to know better. I want you to know that simply cleaning the teeth and not doing the periodontal work is not healthier, is not better. You need to get in, you need to get the dental x-rays, you need to talk about your concerns about anesthesia with your veterinarian, and you need to come up with a plan to safely perform an appropriate procedure. And don't waste your money on these, just brushing the teeth, or, services that just brush the teeth or just chip charter off. It's just cleaning the windows, guys. So wanted to give you that public service announcement so that you guys are informed. Always want you guys to be informed. And yeah, that's it. Catch you guys next time.